She's age 44, new patient, first visit. She is traveling. Where are you coming from? Guntur, Andhra Pradesh, which is southern part of India. Ananya Shamant. Can you speak in English? Only Telugu. You can speak in English. So psoriasis since last 30 years. Where is it? On the hands. You can come in front, have a look if you want. Can you just go there and redness, and the hand also. What does the skin look like?
Scaly, red and
Dry.
dry.
Isn't it dry?
Yes, and thick.
Dry. So the hand. Scaling is there, like scaling. Hindi समझ में आता है?
And round.
What is suitable, Hindi or English?
Both of them.
Both.
She'll be
Scaling, the skin comes out? Comes out. Red, scaly, dry as well.
yellow in the neck.
Since last 30 years, what are the symptoms?
So that's what it's burning. It'll be burning and dryness. It's itching.
Itching.
Yeah, sometimes it'll be all over the body. It comes heavily. Sometimes it's kind of bit under control.
Burning is there?
Yeah.
Burning sensation.
And recently, last 2 years, she started some kind of joint pains here near the nails and nails. This also exists. That's okay.
No, they can hear you as well. I don't have to speak again for that. ওটা দিয়ে শোনা যাবে?
Take comfort.
ওটা ছেড়ে দিন, ওটা ওখানে রেখে দিন।
I'll pull one.
Yeah. So can you repeat the symptoms again? Itching, burning.
Yeah, itching, burning, and since last 2 years, her nails also affected, and joint pain started over here in the first time and over here.
Finger joint pains.
Yeah.
And nails, what is the problem with the nails?
They are yellow and microscopic.
Thick nails. Nails you can cut with the nail cutter. So you can cut it. Quite thick nails, If you can have a look, you can come also and have a look. You see there's thickening of the nails as well. Pain in the nails?
No.
Pain? Pain where? Okay, pain in the nails as well. What else?
So that's it's all over her body, actually in the back and in the legs portion. So it's more itchy and
So it's thick, this area.
it's more itchy and burning sensation that comes out on a regular basis. Yeah.
See the nails thick. There's a layer inside. Finger.
Both the legs.
दिखाइए एक बार दिखाइए.
Oh, okay. Let me. She met with an accident in last December. Actually, her two arms, they're kind of. She's not able to do it.
This finger pain is when?
2 years.
When does she feel that?
It's kind of a daily basis. It's not occasional.
Finger pains, when do you feel that more? If you press it, you feel pain? Finger pain more on pressure? This itching or burning when you have anything makes it better in the skin? Hot water, cold water? No, doesn't make a difference. Any weather when it's worse? Winter, summer, rainy, weather change? No. Any time when the itching is more? Morning, afternoon, evening, night?
day, full day.
Full day. Anything you feel which triggers the itching, which increases the itching? No.
Not exactly.
So when you have the burning, have you tried anything like a hot, like cold, anything makes a difference? No.
So when she think it's dried up, she applies some cream kind of thing, some Vaseline or so that it will be a bit softer. That's what
She applies like a moisturizer to make it soft.
Yeah.
Any other issues?
Other than this,
Other than the finger pain, anywhere else you have pain in any other joint?
Last 5 years back,
5 years back there was in the ankle,
Sorry, there was
joint here.
joint pain in the ankle,
Yeah.
which is there now?
No.
Not there.
No.
Okay. Previously there was pain in the ankle on the right leg, which is not there now. She had a wrist fracture in December 2024, fracture, and since then finger movement is restricted.
Actually, her skin teared off and new skin came in, and during that time the psoriasis in the fingers it increased. Earlier she doesn't have this over here.
Sorry, could you repeat that?
During that time it's all restricted, right? She kept it like this,
Uh-huh.
and all this old skin it tore off and new skin came. During that time psoriasis also spread over here.
When her finger movement was restricted?
Yeah, during that time, in the last 2-3 months,
During-
and now December to this February, and now she's feeling pain in her here.
Where was the fracture? Fracture was in the wrist,
Fracture,
but she's
yeah.
having pain in the palm area now.
Actually, what they did is from here to here, they did that. They put that. What do you say? Like
Cast, plaster.
Yeah, plaster. So she's not at all able to move her fingers even. Yeah.
So when it was immobile, the psoriasis increased, you said,
Yeah, kind of.
right? Any other thing you like to share?
burning was
Now she's feeling burning here in this area currently.
Only in the right palm or both?
right
Burning in the right palm. This is since how long?
1.5 months.
Sorry?
1.5 months.
Since 1.5 months. Anything else? This finger joint pain when you have, anything makes it better, hot or cold?
No.
No. Any time of the day when you feel this joint pain more?
Daily.
Daily.
Throughout the day.
And when you press these parts, does it feel better or worse?
Worse.
You feel pain?
Pain.
Feel pain when you press that part. No other joint pain.
No.
How did this start? The skin psoriasis, how it started? Any reason?
No.
If there was any major disease you had at that point of time?
No.
Any medications you took? Anything? Any emotional?
Kind of
Issues.
emotional, like everything she thinks it more deeper. Yeah, the thinking process is much more into the deep.
Thinking processes deeper.
Yeah.
Like, for example?
Like if something happens at the home with her kids, if they're annoying, if they're not listening, so she thinks more deep into that. She'll not leave it aside after half an hour or 1 hour. She thinks more about it, more emotionally.
Okay. You can hear her? No, Vasu? Can you come here, please? It's possible. Whenever she's having any discord with her children or anyone at home, she thinks about it deeply. Other people may brush it aside, but she tends to ponder over it, right?
A little bit, yeah.
How is the nature? You are how related?
Sister. Yeah.
Elder, younger?
Younger.
Younger sister. How is her nature, temperament?
No, she's cool tempered.
Calm.
Yeah,
She
calm.
doesn't get angry very easily.
Yeah.
So there was any emotional issue when this psoriasis had started? ऐसा कुछ हुआ था when जब psoriasis कोई बड़ा हादसा हुआ था, कुछ दुख हुआ था, ऐसा कुछ? Any grief you had, any trauma happened at that point of time when this started?
No.
Your husband's death was in 2017,
2007.
but this started much earlier to that.
Right.
How many children?
2 children.
2 children, 2 sons.
Uh,
You're anxious about them? You get stressed about them. Or कोई problem? Anything else?
Sorry?
Any other issues?
No.
Got the symptoms up till now. She is age 44, psoriasis, new patient. Itching with burning, redness and dryness, thickened nails, certain degree of pitting as well, yellow in color, burning in her right palm, pain in the fingernails which is worse from pressure. Psoriasis there for last 30 years. Ankle pain was there which is not there now.
How it is started? Beginning what? Which location?
Where it started? First lesion was where?
Small dot.
So the left hand.
Started in the left hand. जीभ दिखाइए. Tongue. Whitish coating on the tongue, not totally coated but whitish coating. Head, eyes, ears, any issues?
No.
Mouth, drooling or bad odor, nothing like that. Cough and cold,
No.
palpitation, breathlessness, appetite is okay.
Okay.
Energy,
Energy.
okay.
Okay.
Any gastric issues?
No.
Bowels is regular?
No.
Regular.
Yes.
Urine, any
This is
problem?
Yeah.
Urine?
No disorder. No
Urine is okay. Sweating, you sweat more or less or average?
Average.
Any odor or stains with the sweat?
No.
Other than the finger, no other joint pains?
No.
Nails, do they break easily? They break easily?
No, they'll not come off. Actually, when she cut it, it will come off. They'll
But it
not
doesn't
break
come
by
off its
themselves.
own.
Not at all.
Yellow, thickened nails, I mentioned that, right? Skin, is there any cracks anywhere in the skin?
बीच में cracks
अभी है? Is there now?
Not now.
कब था?
2 महीने के पहले.
2 months before she had some cracks in the abdominal lesion. हाथ पैर में कहीं पे नहीं आता है. There is no cracks in the hands and legs. No. Warts, moles? No. Periods are regular? Menses regular? 2 children I mentioned there. White discharge is quite often.
No. बीच में.
Occasional leucorial discharge. She has leg pains on the second day of menses. Periods के टाइम पे पैर में दर्द होता है. कहाँ पे?
रात में ऐसा.
Pain in her calves in the second day of periods, more at night. कैसे कम होता है वो?
Psoriasis में not.
Not psoriasis. Yeah, I understand during periods. You have to press it or you have to tie something.
Not
Would
that
you-
severe. Not that severe.
Not that severe. Second day of menses, leg pain at night. Cold weather you like or hot weather you like? You like hot weather. You don't like cold weather. I'm not talking about the psoriasis, but generally
She'll feel more cold actually.
more cold, chilly,
Yeah.
sweet, sour, salty, savory, fatty, oily, bitter. Anything you like more?
Salty.
Salty. Extra salt with your food? No. You're a vegetarian. You like your food served piping hot, room temperature or cold?
Normal temperature.
Room temperature. Any food triggers the psoriasis? Milk, vegetables, anything? Pumpkin. What?
She'll get the joint pains.
Joint pains from pumpkin. That's interesting. Sleep is okay? Thirst, water intake?
Yeah.
Okay. If you get any cut injury, psoriasis starts at that area. If you get a cut, psoriasis patches come at that part. Okay. Any major disease in the past? No. Anyone in the family with psoriasis?
No.
Anyone in the family with any major disease?
No.
Any fear, phobia? No. You're under any medication, allopathic medicines? Homeopathic medicines you're taking right now? You have any prescription?
Yeah.
You like people, social gatherings, you rather be by yourself. Anyone from Andhra Pradesh here? No.
Sir, actually your student Srinivas Rao.
Rao.
Yeah. Some of you were one of the students.
Arsiod was prescribed, Thuya was prescribed. Arsiod, Thuya, Sepia, Sorinum. Arsiod, Thuya, Sepia, Sorinum. You like people, social gatherings, you rather be by yourself. सबके साथ अच्छा लगता है ना अकेले रहना पसंद है?
I mean, when she is with everyone, she'll be more energetic and all. She talks much. So when she wants to be alone, she'll be alone.
ज़्यादा पसंद क्या है? सबके साथ रहना है ना? You like to stay by yourself.
Myself.
By yourself. As compared to being with others, you like spending more time with yourself.
Myself.
Yeah.
Can I ask what time she got, when she got married? She's got about 30 years. Does that relate to when she got married?
Marriage, what age?
2025.
No, marriage
2015.
2005.
2005.
2005 was a marriage. She is born in 1980. And psoriasis started roughly what age? So you got married at age 25, right? And psoriasis started what age?
My 10th standard.
17 years or 16 years.
16 or
She's in her
17.
10th standard.
When she was in the 10th standard.
10th
Okay,
standard.
16, 17. Any questions? Please feel free to ask.
Sorry? No, she's more organized. Yeah.
Very neat and clean, or just
I mean, it's
normal?
okay. Normal, organized. Yeah, she keeps her home clean by herself.
Memory?
Good.
Does she cry easily? Like quite a lot? Or it's
Not
normal?
quite a lot, but easily, triggers easily.
Tears come.
No. No.
No.
Better from consolation or was? When you cry, are you better from consolation or worse?
कोई आके आपको समझाए, somebody gives you some sympathy, consolation, does that make you feel better or worse?
Yeah.
You feel
She feels
some
better.
better.
Better. Yeah.
The menses started at what age?
Menses still happen, it's regular. She's 44.
No, when did they start? Was it late or?
Menarche,
10th,
menses.
10th grade, after her completion. After the completion.
No, period started what age? You remember?
After her 10th grade, yeah.
Which is what age?
Somewhere around, psoriasis exactly, it started in her 11th, okay, 11th grade when she started. Yeah, her periods are before.
So it's 15.
How long before? They are asking if
Probably
the period
2
starting and the psoriasis, was it very
No,
close?
Not too close.
You're sure about that?
2 years long term.
Was she puberty?
Yeah, yes, not too close.
How much? Not too close.
I think it's there a year. As far as I remember, when she was in her 11th grade, that's when this all started towards the end.
So
of
around age
11th
16, 17.
grade. Right, yeah.
And
1 year
period
before.
started approximately what age?
Immediately after the completion of 10th grade, we are around 15 or
15.
so.
So the year before.
Yeah, year before.
So puberty.
Any heaviness in the breast before menses?
No, it's not. No, nothing like that.
No. Miasm, skin? Only psychotic?
Dry.
What's the sodic feature in the skin? Dry. What is the psychotic feature? Thicken of the nails. Okay, that's psychotic. The yellowish nails is psychotic. Circular, very good. Yes, circular is psychotic. You see the hand, हाथ थोड़ा psychotic. Circular patches in the skin, psychotic. that their left hand also, there are quite a lot of circular patches. Not all the patches are circular, but there are quite a lot of circular patches. Remember, circular is psychotic, right? Any tubercular symptoms? Redness is tubercular. Yeah. Anything else before we analyze? Anything else you like to ask? Please feel free.
And secondly, would be when she gets a scratch or something, psoriasis would start. Would that be?
Not necessarily, no. Because that can be sometimes common with a psoriasis patients who has had it, all over the body. What we have here, we have red. Have a seat, please. Have a seat. Red and dry, with thick nails, which are yellow. About the psoriasis, red, dry, circular. Is there any scaling, flaking? चमड़ा निकलता है? Quite a lot? ज़्यादा? कब?
During the nights and all.
You understand what I mean? Like skin comes out.
Skin comes out.
That happens from where?
The legs part.
Legs part.
Like big scales or small, like powdery scales?
Small scale, sir.
Small scales, but scaling happens. Okay, so add scaly please, Maazam. You see now, this is important to understand. If you look at the skin, it's a mixed picture. There is redness of tubercular, there is dryness of psora, and there is psychosis circular, psychosis scaly. Now you combine that with the nail. Nail is predominantly psychotic. Where you have thickening of the nails, you have yellowishness of the nails. It's not brittle, it's not dry, but thickened and yellow. So you understand here the surface miasm is more psychotic rather than the other miasms. So you have to incorporate a remedy which will incorporate the psychotic miasm. You clear with this? Because you are incorporating nail along with the skin manifestation. And you must incorporate the miasm here as well, because the nail is predominantly psychotic. You see, out of all the nails, dikhaiye. Thickening is present in at least 3 out of the 5, 4 out of the 5. You see the thumbnail here, thick. You can see the layer it's thick, and there is a yellowish tinge to it. So there is a psychotic preponderance. That's the surface miasm. Now combine that. So even if you are confused with the miasmatics of the skin, the nail will guide you that yes, I need a psychotic remedy in the case. You see, that's how miasm will help.
Yeah.
So you have thick nails, which is yellow, which is psychotic. So you have circular from the psychotic aspect, you have scaly from the psychotic aspect. You're with me here?
Yeah.
What else do we have? Finger pains, worse from pressure. No, psychotic will be better from pressure, my friend. Skin better from? Yes, to a certain extent I will agree, because she said when she was immobile, the hand was immobile, the psoriasis flared up, right? So I will say, put here, it's a question mark, but aggravation rest, or aggravation when static. Burning, thank you, thanks for adding that. Burning with the skin, with the right palm. Right, burning with the skin, burning with the right palm. What else? Not anything else? Sorry, Devang?
Discords and the home aggravates the psoriasis.
That aggravates the psoriasis? Did she say that? Like if there is any problem at home, any emotional issue that flares it up? कुछ अगर घर में प्रॉब्लम हुआ, आपको बच्चे के साथ कुछ टेंशन हुआ, तो स्किन बढ़ जाता है, प्रॉब्लम होता है इसमें? नहीं समझे, if at home you're tensed about your children or there is some problem, does that affect your skin? In what way?
When I'm emotionally feeling, increases the psoriasis.
Increases, thank you, yeah, correct. So I will say aggravation, emotion, any emotion can flare it up, right? Chilly, desire, salty. You have a rubric. What is it?
We don't have it.
Thank God. Any grief? Abhi you feel sad about something, depressed, anything? Sure. Children are what age?
7th class,
And another one?
secondary, BTech secondary,
So around 20. One is 20, other is 10,
13.
13. Better by consolation. Anxiety or fastidious is not very much, so you cannot consider that as much of a factor. Calm, okay, I'll take that. You mean the husband's death? But this was present even prior to that, so 2-3 things I'm thinking of and I'd like to share that with you. First and foremost is Keliars. Keliars, when you पैर थोड़ा दिखाइए, that leg. This scaly appearance of the skin is very characteristic of Keliars. Scaly appearance of the skin. Look at this patch, please. Silvery, shiny appearance. You can look, Ridhima. Scaly, shiny appearance of the skin. This one is scaly and shiny, and the leg is scaly. So dry scaly or shiny scaly, right? Dry scaly or shiny scaly. See the scaly appearance, right? Dry scaly or shiny scaly. You're with me? That's typical of Keliars appearance. So never forget that, please. With Keli aggravation pressure, all Kelis are sensitive to touch and pressure. Keli aggravation pressure. Burning of arsenic in a chilly patient. You're with me for Keliars? Dry, scaly skin, A. B. Shiny, silvery appearance of the skin in a patient who has burning of arsenic with chilliness. Open Keliars, please, in boric. It mentions in boric that it's used for invertebrate skin conditions which have been there for a long time. You understand, the person who prescribed ars iod was close. There is arsenic symptoms, but she's a chilly patient. Arsenic iod has to be a hot constitution. There is arsenic features. There is that chilliness, there is that burning, which is arsenicum. But Keliars is much better adapted to such skin conditions. If you are there in Keliars in boric, Keliars patient tends to has malignancy in invertebrate skin diseases. Skin section, itching, worse, undressing, dry, scaly, wilted. So you have the dry, scaly here, but also it doesn't mention boric. Put a note, silvery, shiny appearance. Like silvery scales, like it's shining. That also works well for Keliars. And burning of arsenic. And as Keliars is a combination of Keli and arsenic, many times, not this case, you can find a lot of weakness. As Kelis are weak, arsenicum is also weak. You are with me for Keliars? Second one which I am thinking of is definitely X-ray. X-ray is a psychosyphilitic remedy. There is no syphilis here, but predominantly psychotic aspect. What is the psychosis? The circular patches, the scaling, the thickened nails. I shared that with you for X-ray. Thickened nails, yellow nails, psychotic. X-ray can address such long-standing cases of psoriasis as well. 30 years is quite a long time in a patient's life, and you understand, I've shared this with you in the past as well, the depth of the disease should corroborate with the depth of the remedy as well. If a disease is of a 30 years standing, suppose I go ahead and prescribe, I'm not saying it cannot be, say I started with a petroleum, I started with phagopyrum, but it doesn't have the depth to touch that case. For a 30 years long psoriasis, you need a remedy which will go to that depth to take it out. You understand what I mean? So the depth of the disease should always corroborate with the depth of the remedy as well. And the third one which can come up in such cases, especially of long-standing psoriasis, what you have here, redness like sulfur. You have the dryness, again to a certain extent like sulfur, right? There is certain degree of scaling because of the dryness. And what is redness? Redness is congestion, right? Allen's keynotes at the end, bowel nosode section, have a look in Morgan Pure, please. Morgan Pure. Morgan is a remedy, my friends, again for long-standing skin cases. M-O-R-G-A-N, Morgan. Morgan for skin, it's a combination of sulfur, sorinum, graphitis, petroleum and tuberculinum. So when you have a mixed picture of any of these remedies, tuberculinum, sulfur, sorinum, graphitis, petroleum, it can have the dryness of sulfur, it can have the redness of sulfur, it can have the cracks of graphitis and petroleum, or you can have the redness of tuberculinum. Think of Morgan in such cases. If you are there in Morgan Pure, please. You see the skin, the redness is not an active redness what you find with tuberculinum. Tuberculinum is flushed. Here it's more like of a reddish hue, but the dryness is also there. You agree with me? Redness is there, but it's not flushing red, what you get with cases of rosacea or cases of atopic. It's more of a passive redness, but there is the dryness to go along with it. Have a look in Morgan, please. Where is it? Where is it? Where is it?
Sometimes it will be more reddish in color.
More reddish.
Burning situation.
When it burns, it can get more red. Okay. When it burns, it can get more red, like sulfur. Right? She says when it burns, it can get more red. Anyone found Morgan? I didn't. Morgan, second paragraph. The keynote for the Morgan group is contained in the word congestion. So congestion like tuberculinum, congestion like sulfur. So that's why I said you can have the dryness and redness like sulfur. You can have the cracks of graphitis and petroleum. And you can have to a certain extent the congestion and the redness of tuberculinum. You're with me? Skin. Morgan is a nosode indicated where there is congestion of the skin with itching eruption. The type of eruption can be ascertained from the provings of well-known skin remedies found among the list of remedies associated with Morgan. Sulfur, graphitis, petroleum, sorinum. So as I said, dry and red of sulfur and sorinum, dry and red of sulfur, cracks of graphitis and petroleum, and redness of tuberculinum. Obviously sorinum can have any of these features as well. So when these skin medicines haven't worked, or you understand again the depth of the disease, you need a deep acting remedy many times to pull it out. We'll start the case.
So Morgan Pure or Bow?
Morgan Pure. The two Morgan Pure and one of them is Morgan Gartner. This one is Morgan Pure, the congestion one. We'll start the case today with X-ray. Okay? X-ray. Considering psychotic to be the predominant miasm with the thickening of the skin, thickening of the nails, the yellowish nails, and there is circular patches along with the scaling. I am putting a note for X-ray for Kelly-Ars and Morgan later on. Potency? 30. If it was a hot patient with the desire for salty, with the psychotic, bacillinum can also help such cases. So, no, but it's a chilly patient. Chilly is more for tuberculinum. If it was a hot patient, you can think of bacilinum with the hot psychotubercular aspect. Psychotic, and the tubercular is the redness, but it's chilly. Tuberculinum doesn't have that affinity for, it was more reddish hue rather than the active redness of tuberculinum.